We are in the midst of a digital revolution where the electronic exchange of information is changing every aspect of our society. The electronic or e-age is upon us. We do e-banking, e-reading, e-reservations, e-communications. We take classes online. We get maps and directions online. We do business online. We do research of all kinds online. In this electronic world, we have more information at our fingertips than ever before, and we have access to it almost immediately. The expectation of immediate access to all this information is changing policies, systems, and operating procedures in all sectors of our society. It is truly causing revolutionary changes in our world, and these changes will only increase in speed and impact. The world of healthcare and public health is also being affected by these changes, which have major implications for the health of individuals and communities. On today's episode of A Public Health Journal, we're going to examine the world of e-health and its potential for creating a healthier world. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to focus our attention on the issue of e-health, the electronic exchange of information in our efforts to protect and improve the health of all Minnesotans. We'll look at the use of electronic health records that help clinicians more effectively treat individual patients, and we'll also look at the potential of e-health in improving the practice of public health that improves the health of communities and everyone who lives there. Joining me in this discussion is Dr. Marty LaVenture, Director of the Office of Health IT and e-health at the Minnesota Department of Health. Dr. LaVenture initiated and leads the statewide Minnesota e-health initiative. He is also an adjunct faculty member at the University of Minnesota and a nationally recognized expert on e-health. Marty, welcome to the program.
Glad to be here. Thank you for the opportunity.
Yeah, and it just really struck me. I've been doing this program for a long time, and e-health and all of the electronic information is so important to public health, and yet I've never had somebody on the program talking about it. So you're going to be a pioneer on this show for this conversation, and there's a lot to cover. So why don't we just start out by saying, what is e-health and what is e-public health?
Well, great question. And e-health is really the effective use of information and technology to improve health and health care for all people. And that's, I think, an exciting time when we look at e-health as really a way to share information in new ways and new opportunities to improve health.
Mm-hmm. And so what's the Minnesota e-health initiative that you initiated? What is that all about? And we have a slide here that sort of, I think you use as sort of a framework or sort of a logo for what you're talking about.
Well, the Minnesota e-health initiative was established actually 10 years ago under the framework of the Department of Health to coordinate health and e-health activities statewide. And it formed in this picture a model that said e-health isn't just about clinical care, it's about the entire community. And that's where the four circles come to represent. It's that clinical is a portion of it, but also the consumer and public health and research and policy all working together to improve the health of citizens. And so as we begin to celebrate this and look back over these 10 years, this model has served us very well to provide a comprehensive framework across a spectrum of all services that could really affect and improve health.
Now, I suspect most of the attention has been on that one clinical circle. I mean, people understand electronic health records, electronic medical records. They know when they go to their doc, they see the docs on the computers. I assume that's where most of the attention has, but is more attention starting to focus on some of those other pieces?
It is, yes, and that's the exciting part. Tremendous progress has been made in Minnesota with electronic health records in the clinic and hospital settings, in particular because of the federal dollars that have provided incentives for the purchase and use of that information and creation of those systems. But also we're seeing long-term care, we're seeing local public health departments, we're seeing even dental offices that are also beginning to adopt and use electronic health records so they can do e-prescribing and not have to have the patients carry paper prescriptions around, that they can allow consumers access to information as well. All the services that go with the benefits of providing really e-health services.
And I know you also have a slide that's up next on sort of the model of e-health. Maybe you could walk through sort of, it looks like it gives sort of a framework of how you move forward on a lot of these discussions.
Yes, in 2008, the e-health initiative developed a state plan as part of our legislative charter. And that plan outlined really 3 steps that any setting, whether it be public health or a clinic, hospital, behavioral health setting, should use when they think about an electronic health record. To break it into, first, what is the technology I want to adopt? And that's the reflection on the lower left of the diagram. So you first have to acquire it through a structured process. But the important 2 elements follow, and that is next is the effective use of that technology. You don't want to just put it in and turn it on. It's got to be solving the problems of providing better care. Things like decision support, giving guidance to clinicians, creating reports that manage the populations all become effective use of that electronic health record. A critical next step. And that optimization of the EHR is what goes on sometimes for years to assure that it's providing good services. And the third element to the right is exchange, where you'll be able to not only in your own setting, but you can send and receive information. So if someone's discharged from a hospital to a nursing home, you want to provide those discharge instructions electronically to that long-term care or to the public health nurse or to the health department that may need to follow up with a particular patient or provide services that are necessary. So that information can be not only delivered but then provided back to the primary care physician. So exchange of the information securely is very important.
So it sounds like it's a lot more than just computers and software. It really sounds like it's education, it's leadership, it's buy-in, it's collaboration, it's changing systems and processes of how we do care and how we educate and how we communicate with folks.
That's absolutely true. In fact, some people describe it as it's 20% technology and 80% sociology in the implementation and using of electronic health records. That really organizational change, that structure in the way we change the flow within a clinic or setting all becomes very important.
And now I have a couple of slides that really show what's happening with the initiation and engaging of the healthcare system. This one looks at the health records, electronic health records in Minnesota. Tell us what's happening. It looks like big changes have happened.
They have. When you look back over 10 years, under 20% of clinics or hospitals were doing some e-prescribing. In fact, or had electronic health records. And then this past year, Minnesota is near top, if not top in the nation for the adoption of the electronic health records. We can still improve in the areas of use and exchange, but in having that first key step in terms of getting the EHR into the setting, we've made huge progress.
Right. So you got hospitals and clinics and pharmacies actually doing really, really well. And what about, let's look at the next slide, which shows some of the other components that are using electronic health records. And it looks like generally folks are doing pretty well.
If we measure it on the first step, the adoption part of that model, then terrific progress is underway. The challenge is that really only clinics and hospitals have a standard set of functions right now. So the other settings, although they have technology, it may not always be standardized. And so those guidelines for standardizing an electronic health record for a dental clinic or for a long-term care facility are still emerging. So the good news is that they're moving in that direction, but we still need to make progress in making sure that it's standard functions in each of the systems and they have the standard capability like exchange or e-prescribing or others, and it varies a bit at this time. The good news is they're moving forward.
So I suspect things like local public health agencies or nursing homes don't have sort of the standardized things that happen in hospitals and clinics where it's the same sort of process over and over and over again. There's lots more variability and have to build in a little different kind of structure.
Yes, not all the data is yet standardized. They may have, for example, some areas are like immunizations, where immunization data is fairly well standardized for and moving probably the best in terms of public health data between different settings. And so local health departments have adopted a couple of different types of systems in Minnesota. Many of the functions are the same, but there are not standards for those functions yet. So it's really activity by activity, like immunizations, and others areas like MCH are not yet standardized for that information. And that's what's really essential for that third element in the model to make exchange of the information really work.
So has the buy-in on the clinical side been pretty good with electronic health records?
It's been terrific in terms of Minnesota leading the country in the adoption. There's still issues, though, with the effective use. Clinicians that have clunky software that, although it's running, it maybe takes 10 steps to do what you normally would do in paper in 2 or 3. Yeah. So it's sort of like software early years development. The first Windows, the first even Macintosh could be improved. And so the interfaces with electronic health records remain a challenge, and that is what we see as an area that will need the most amount of improvement.
Right. Well, I want to look more specifically at the public health aspects of e-health, but first we need to take a little break.
Great.
We'll be back right after this message.
Raymond, look at Mommy.
Maybe the light hurts his eyes.
Maybe she's just not hungry. Maybe he can't hear us. Maybe we're not stimulating him enough. Maybe it's a phase.
Avoiding eye contact is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
Welcome back. We're talking about e-health or electronic health, how it's used in the medical care system and in public health and in all things that relate to the health. And we're talking with Marty LaVenture from the Minnesota Department of Health. Marty, I'm going to take this in a little different direction because in public health we're looking at how do we improve the health of the entire population, and we know that public health deals with a lot more than just the clinical care. And in fact, I have a slide here that shows what determines health, and we know that health is only about 10% of our overall health is the clinical piece. And a lot of other things are behavior, individual behaviors, but a lot of socioeconomic issues and environmental issues and genetic issues. And so when people think about health, they think about medical care, and I think most of our electronic stuff has started with around the clinical side. But I'm going to talk a little bit about how do you deal with the e-health with all of these other components, the other 90% that's outside of the clinical care sector.
Well, it's a great question because social determinants of health, as you described, are critical as we look at health. And when we look at e-health, it's all about the information and effectively using information. It's not about the technology per se. Technology is necessary but not sufficient to really provide the kinds of more than information knowledge that's necessary to make good decisions. So bringing together social determinants of health, or really using data that's collected around social determinants of health, become a critical factor in making decisions. We're not yet at, and we have the potential to really gather and use that information and put it into dashboards, put it into tools that allow for better decision making by consumers in the form of, as we have apps these days on phones, how do we get information in the hands of the consumers that is consumer specific about more than just their clinical care. Factors that may affect their decision making related to their health. How do we get information to providers about better decision support? So when they're using electronic health record, that they may know the contextual relationship of that person, the neighborhood that they're in, the prescription for healthier foods and where it may occur in their neighborhood, so that it can provide guidance and prompt right at that care visit, whether it be a clinical care, a public health service visit, a behavioral health, or whatever the setting, that information about the contextual social determinants can be made available relative to the needs of that individual client. And then in the community, how do we better profile the community itself, getting the information to the decision makers, policymakers, and other interested persons to say, do we have good distribution of adequate food or supplies or walkable neighborhoods in our community, and beginning to bring that together. That's the great promise of the effective use of information that eHealth really brings.
And we just put up a slide that shows some of that community health and well-being, the community health model. Explain a little bit about what this is all about.
Well, the community health model starts to look at the whole notion of really empowering a community with knowledge. And how do we begin to use all of the institutions in a community that can begin to provide information and use information in a collective way to make better health. And I think this model is a nice way to graphically express some of those kinds of really frameworks for how we look at information in a broader sense.
So what are the circles that you're looking at, that you're as part of this model? Certainly, businesses, healthcare, public health, community organizations, the social interaction, social structure that's there.
I think all of those elements are really part of the discussions of how we should be looking at information, and because the health of individuals is affected by many parts of our lives, and our lives touch many elements of in the community. Whether it be the business, whether it be the social factors, whatever the elements might be, and each of those then allow us to provide, in a sense, a broader framework for public health for information.
So is there a model anywhere in the country or in the world where this is actually happening? Because what you describe is, people live in a community, so their health is in the context of where they live and what their work and their social relationship and their economic stature. And so having that information would really be helpful both to clinicians and then also to community members. Is that happening anywhere where that actual information is being shared in an effective and secure and safe way?
Well, I think there's elements of that's happening. I'm in various communities in Minnesota. The Beacon Project in southeastern Minnesota that provided an opportunity, or at least around one condition. It rallied the schools, the public health, in other settings in addition to the clinical settings to look at asthma and how do we as a community and maybe establish a model for sharing of information so everyone wins out of it. That appropriate types of care is given, but also prevention is a critical element in how to prevent of the various issues associated with asthma. So it's a great, that's one example. The emerging state innovation model for accountable care communities in Minnesota is looking at empowering communities with ways in which they can better use information across those communities to address all of the issues related to health. And we'll get into more factors associated with that as well. And those offer, I think, great promise, but they're just unfolding.
Yeah. Well, I want to talk about the future, where we're going and what needs to happen, but first we need to take another little break.
Great, thank you.
We'll be back right after this message.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
Maybe he's really focused.
Hey, Michael. Michael. Maybe he likes spinning the wheels.
Maybe he just loves trucks.
Maybe he's just being a boy.
Preoccupation with objects is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
Welcome back. We're talking about eHealth Initiative in Minnesota with Marty LaVenture from the Minnesota Department of Health. Marty, we're in this rapid changing world of eHealth and all of the technology and all of the data and all the social media, and so we need to start looking at, we need to continue to look, because I think you've started looking at where do we go from here, and we have a slide here that sort of shows sort of that incline of where we go to get healthier communities, and I'd like to have you walk us through where we are and where we need to go with the whole eHealth initiative.
Absolutely. This slide we affectionately call the incline slide because we're trying to really achieve healthier communities, but public health as a community, although we've done well, we're kind of sort of stuck in the lower left part of this incline around, we collect a lot of data, we create a lot of table graphs and charts we call information, but we really haven't moved to the level of creating knowledge. How do we use an understanding of that information to improve change? We really haven't created the wisdom of bringing that types of social determinants into the context related to our health data, and then really haven't translated that much into how do we address community issues, turn it into practice so we can achieve healthier communities. And that's where we really need to go, is to make that, that change from being stuck in the increasing flow of lots of data, but really turning it into knowledge and information. And that's a critical piece.
Who needs to be engaged in this to make that happen?
That is, lots of people need to be engaged. First of all, there's a leadership element of commitment to make change. This involves more organizational change than it does technology change. This is largely an organizational and leadership piece to say, let's look at how we collect, analyze, and distribute information in different ways, and how do we put it, more importantly, to effective use of that information.
Well, we have one more slide that shows, how do we prepare? What's sort of the elements that are necessary for eHealth? And it looks like it's a lot more than just the technology.
It is more than technology. This is a nice little example of, okay, what can we do now? And one thing I think health departments need to be thinking about is that we've relied a lot on just IT and say, let someone else do it. We need to be taking, I think, responsibility and control for the public health aspects of information and realize that to create the types of systems that will generate the knowledge and wisdom that we want in healthier communities, we have to look on this slide and see that technology is necessary but not sufficient. We need to look at the content and the processes of how we use the information in that context to create more effective information systems. So that's one example.
Yeah. So do we have the commitment? Do we have the leadership? Do we have the desire to actually move this forward?
I believe we do. I think it's, as we've done in the past, we've had that commitment. It's really moving collectively to do it. We've done it with epidemiology, as came out of the university settings and moved to an applied setting at state and local health departments in the late 70s and early 1980s. We've done that with preparedness in the late before the turn of the century to the early 2000s in terms of public health responsibility. I believe now this is the information digital age, and we need to do the same thing now and collectively make that commitment.
How will the community members see that something is happening differently?
I think we have to see that there is incremental change and that we have both think broadly but implement incrementally. So we have to say, what's our shared vision? Mm-hmm. And one of those shared visions is that we can do this all as we have alone, and we go quickly to implement some systems, or we can do it together. The old African proverb of, if you want to go fast, go alone. If you want to go far, let's go together. And that's the critical aspect of eHealth today.
Well, let's end with that. It's nice to be together with you, moving this whole issue forward. Thank you. This has been very helpful, and I'll have to have you come back again to expand on all of the other things that are going on in eHealth.
I'd be delighted to. Thank you for the opportunity.
Great. I'll be back with a closing comment right after this message.
we budget, so don't accept defeat.
Now you can get covered and still buy me treats.
You take care of your pets. Now it's their turn to take care of you. Visit getcoveredamerica.org to learn about your health insurance options.
Medical care contributes about 10% to our overall health. The biggest contributors to health are what we call the social determinants of health. That is, the life-enhancing resources such as food, housing, economic and social relationships, transportation, and education. These are the things that have the biggest impact on the length and quality of life. These social determinants of health are the conditions in which people are born, grow, live, work, and age, and are shaped by the distribution of money, power, and resources. The social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status within communities. To me, e-health is one of those social determinants of health. It is something that is beyond the control of the individual. It is controlled by the broader social and economic structure, and it impacts health. That's why when we are discussing the use of electronic data to address health issues, we need to build in meaningful ways to include the broader community into those discussions and into the decision-making process. Otherwise, important decisions about our health will be determined by those with money, power, and resources, and that has the potential to sustain or expand the health disparities that currently exist. So in our discussions about e-health and the data that forms its core, we need to continually be asking who owns the data, who controls the data, who decides what data to collect, who decides how the data are used, and who evaluates the use of data and provides oversight. We need to see data as a public good that requires public involvement and oversight. Only then will we be able to maximize the benefit of e-health for all members of our community. That's all for today. Thanks for watching. I hope you can join us again next time on a Public Health Journal.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.